Thank you to Chairman Altman, the HPC Commissioners, Executive Director Seltz, and the HPC staff for inviting me to speak at today's hearing and for your ongoing commitment to improving access to health care in Massachusetts. Thank you to the health professionals, essential workers, and all others on the front lines of this crisis. You have helped us through a difficult first phase of this pandemic, shouldering extra burdens and risks, and we are grateful to you. Though the pandemic has affected all of us, the burden of COVID-19 we know is not falling evenly across Massachusetts communities. The data clearly show that Black, Hispanic, and Latinx residents are more likely to be infected by the coronavirus than white residents, and that communities of color continue to experience higher rates of COVID-19 deaths. Those hit hardest by the virus were disadvantaged, of course, before the pandemic even began. But COVID has amplified and exacerbated the social, economic, and environmental inequities that contribute to worse health outcomes in communities of color. For example, people of color are more likely to be essential workers, to rely on public transportation, and lack space to quarantine effectively at home, all of which put them at a higher risk of infection. In a recent report, my office found that long-term exposure to air pollution and other environmental harms make residents in low-income areas and communities of color more susceptible to the coronavirus. Air pollution disproportionately affects the health of Black, Latinx, and Hispanic communities in part because industrial facilities and highways are concentrated in low-income communities and communities of color. These social, economic, environmental inequities are not new. They are legacies of structural racism and racial discrimination that continue to harm the health and the well-being of marginalized communities, as they have for generations. In addition to bearing disproportionate adverse effects from social determinants of health, communities of color also suffer worse outcomes from our healthcare system itself. Though the Commonwealth is a national leader in health policy, the disparate effects of COVID-19 provide a somber reminder that our healthcare system still fails to equitably serve communities of color and low-income residents. In past cost trends reports, my office has shown that there's a mismatch between health need and healthcare resources. We spend most on healthcare in the highest income communities, even when we account for health need. We systemically underinvest in the health of vulnerable and marginalized patient populations. So where do we begin? To advance equity in healthcare, we need to take a hard look at how we deliver and pay for healthcare, and we must be willing to change long-standing systems that disadvantage marginalized communities. We must also recognize that the healthcare system alone cannot end health disparities, which are rooted in a broad range of deep-seated inequities. We need to expand our conception of what we mean when we talk about social determinants of health in our research and policy proposals. And at the same time, we need to focus on specific steps we can take now, in the next months and in the next legislative session, to address long-standing shortcomings in the opportunities and resources available to our marginalized populations. We need to think about educational opportunity and environmental justice, for example, as areas for action to address racial justice and equity, and also to address health equity. We can and must do this even while we sustain our focus on the healthcare system itself to continue to press forward on efficiency, access, and quality. My team's been focusing on these issues, and your participation in today's hearing suggests that collectively there is much we can do. Over the years, Massachusetts has taken bold action to address healthcare quality cost, and access. I'm confident that we have the resources, talent, and vision to emerge from the COVID-19 crisis not only as a leader in healthcare, but also as a leader in health equity. COVID-19 has shown us that these actions cannot wait. With the support of policymakers, providers, payers, and other stakeholders, we can ensure that all Massachusetts residents, regardless of race or ethnicity, have access to affordable, safe, quality health care. Thank you for the good work you're doing and the work that we're going to do together.